Hello, everyone. My name is Julian Kirko, and I will be sharing my PowerPoint right now. Right. Hello, nursing faculty here at our Penman School of Nursing. Thank you for attending this presentation. I've chosen scenario number 2, that of reducing the central line infection rates in the med-surg floor. In this presentation, I will utilize the low fidelity simulation in the education department by guiding floor nurses into providing appropriate dressing change. This PowerPoint will present the standard way of performing dressing change grounded from evidence-based practice that is being utilized in today's healthcare environment. The goal will be to reduce central line infections by applying these interventions and also by applying the correct and usage of PPE. Central line bundle performance monitoring consists of 3 main components: that of hand hygiene, use of chlorhexidine skin preparation, and the selection of appropriate site for central venous access. Aseptic technique has been clinically proven to help reduce and prevent healthcare-associated infection, which leads to my question of the day during this presentation. Should central line dressing change be implemented with a clean or aseptic technique? This PowerPoint will present especially central line associated bloodstream infections, also known as CLEPSI, which are some of the most serious complications in hospitalized patients. Compliance with the elements of hand hygiene, chlorhexidine use, and dressing changes were frequently utilized during this presentation. CDC guidelines for handling and maintaining central lines include recommendation of a daily bath with a chlorhexidine prep for every adult patient with a central line. This has proven to reduce CLEPSI and reduce overall infections. And based on research, aseptic technique is a preferred choice that has shown improvement in decreasing infections. Little background history: an estimated of roughly 30,000 CLEPSI occur in the US each year. Mortality rate for patients with central line is at about 16%, and of those patients without a central line at 6%. With these staggering percentages, the Center of Medicare and Medicaid have taken actions against hospitals by reducing their payments due to poorly controlled infection rates. CLEPSI bundles are divided into 3 categories: insertion, maintenance, and patency. Recommendations include proper hand hygiene with soap and water, use of PPE, chlorhexidine skin antisepsis, optimal catheter site selection, and daily assessment for removal of unnecessary lines. It's significant at reducing central line infection rate, leads to reduced mortality in hospitalized patients, early identification of patients at risk, and of course, as we know, most infections are preventable, which can lead to more complications. A recent study suggests that nurse educators' understanding of the topic is suboptimal. This gap in fundamental nursing education is a cause for concern, as it places patients at risk for cross-infections and inability to safely respond to these practices. The use of PPE, as we know, is a very fundamental element of infection prevention in healthcare settings. A recent study found that healthcare workers who were trained using the CDC recommendation regarding procedures had lower rates of self-contamination than those without such training. And also it was revealed that the most contaminated area were the hands. That's why hand washing with soap and water is so critical, with 65% being more right-handed, as more people are right-hand dominant. Another study found that the cost of one patient having or getting CLEPSI is around 48,000, which is a staggering amount. Aseptic technique helps prevent healthcare-associated infections. What must the nurse do when changing a central line dressing? There is an 8-step protocol that was found through evidence-based practice. Number one, of course, is to wash hands with soap and water, is to prepare your work area, make sure that it's a clean and a flat surface, lay out your supplies, remove the old dressing. Then as we have to prepare our sterile supplies, clean the catheter site, let it dry, and then we apply the new dressing. And when available, the utilization of Kuros caps, those are the green caps. As different hospitals have different protocols, always follow your hospital protocols and try to round each day with a care team, and hopefully we can remove central lines as soon as possible. Always perform routine dressing changes using aseptic technique with either clean or sterile gloves. As nurse educators, we must dedicate enough time to adequately educate staff on practices involving central line use, care, and maintenance. Implication for practice, sorry, jumped one. Implication for practice, continuing education is a must to keep the nurses up to date with current practices, and commitment to continuing education should be critical to promote evidence-based practice guidelines for the use, care, and maintenance of central lines. Assessing nursing comprehension and practice in an effort to standardize that practice through the use of pre- and post-test periods. Educate and empower nurses to report any improper technique or gaps surrounding a patient's central line and maintenance for proper care, avoiding fatal complications. As nurses, we should always place the safety of the patient first, as there is always room for education and growth. These are the references, and I want to thank again everybody for joining me for this presentation. Any questions, feedback will be greatly appreciated. Thank you very much.